Hey, Jamie, so are you jealous that I get to hold Mr. Eggplant and you get Mr. Grower? Who would you rather have, the grower or the shower?
Well, I don't know. As long as it functions right,
We don't care.
I don't care.
That's what I
It's
say.
got to work.
There you go.
What about you? You don't get away with that, not answering that question.
I think sometimes the shower is not as exciting. You know what I mean? It's kind of what you see is what you get. I think it's more fun to have a little bit of surprise. Like, how far is it gonna grow? How
And
big can you go?
How big can you go? And
There you
how
go.
well will you
And
work
how well
it?
does it work? Because that is what we care. So welcome back to Cheung Chat. We are here today, happy hump day, and we're talking about commonly asked questions because that's what we do here. We try to educate, right?
Yep.
So Jane, what are some of the biggest things you're having people coming in for? What are they concerned about now?
I would say a hot concern for people, especially in this pandemic, is the Zoom. A lot of people are coming in and they don't like the way they look on camera. So I want to say that eyes are definitely a focal point, not just for the masks and stuff, but so many of all of you at home, you're on Zooms working from home, and the focal point, and you're not used to seeing yourself every day
That close,
and how you present yourself to other people. And so I think that eyes are a big thing, the rejuvenation of eyes. What about you, like when you're doing your consults?
I got I do this and I really want to have that.
Yeah. Well, it's funny. I feel like people are focused on this with Zooms, and then it always goes back to sexual health because when they're just home more.
Yeah.
People aren't traveling as much, and you can't have the excuses of I'm tired and I'm doing this and that. So
it makes the time go by when you're getting intimate, right? Makes the day go by. It helps quarantine pass a little faster.
And
right?
that's when we hope that it's functioning.
All these things are working well, yes. So what are some of the biggest things we do for eyes? I mean, aside from surgery, yes, we respect surgery. It's efficient and effective, but it doesn't last forever because it's the same skin they're cutting and putting back together, right? So
I always tell people, it's a no-brainer for Botox. That is, that's a for sure thing. It's always works all the time, and it's amazing. But
and you're due for your Botox.
I am due.
Yeah, let's see. Smile. Look at those wrinkles. Okay.
Thank you, Dr. Chuck.
Oh, you're welcome.
We're victims too here. But we have a lot of treatments actually for the eyes, from RF microneedling, which you're able to do on the upper lids, to just light resurfacings. There's a lot of different things that are going to help with lines, wrinkles, texture, brightening up the eye area, lifting as well, including all therapy, which we love so much. So
eye bags.
Eye bags are a big thing with Agnes. We have Agnes for that.
Melt the fat or inject the fat with Kybella.
So just like anything, there's no one size fits all. It's everybody's different. And, you house a lot of pretty amazing tools here. So we have a lot of different things to choose from.
Yeah. So let's see. I had a patient yesterday who had eyelid surgery about 12 years ago. And he's like, yeah, it's back again. And you look at him, he's got a little bit of hollowing. He's got a little bit extra skin. His skin's really thin. You can see the veins peeking through. So we talked about, lasering the veins away, like lasering away the fat, tightening the skin with some resurfacing. You can put threads under the eyes to help out with collagen stimulation to make the skin tighter. Putting fillers over the eye cheek area to kind of help, hide those hollows that you have. Men don't want downtime, right? Because, yes, you're on camera, you got to go to work sometimes now, and we don't, downtime is, people don't want downtime.
Yeah.
So.
And I love that the men are really dipping into the treatments too.
Oh,
but that's what's so nice is, the advancement in technology has changed so much that you can get these treatments done without having the downtime, and that's pretty awesome.
Yeah, because I want to look
for anybody. People are still on Zooms, or some people are back in the offices now, and it doesn't mean you can't have these treatments done.
So let's talk about therapy, because people don't really understand what it is, what it does. Because it's like my favorite treatment to have done. That was the first procedure I had after quarantine. I was like, I need to do this with my face, and so what does all therapy do?
So all therapy I describe, when I'm talking to somebody about their skin, I talk about interior and exterior. Interior meaning that collagen production, exterior meaning, the outside visibly what you're going to see. So all therapy is foundational. Every single person should be having all therapy. I actually like to start with that because it's like your home. If the foundation is strong, it's going to hold everything else and support it much better. All therapy is actually not a laser. It is ultrasound that we are delivering very deep into the skin. It's actually the same depth that they cut to for a facelift. And it's helping promote collagen and elastin. But just like anything that you do to promote collagen and elastin, it is a treatment that works over the course of time. No one's going to look at you the next day and be like, what did you do? You look differently. But that's what people love.
Right.
Because not everybody wants people to know that they have had something done to themselves.
Right. Yes.
You just begin to look better and better over time.
Yes.
So all therapy is, it's a necessity for everybody. It's a staple. I call it a staple in your skincare program. But it can be done alone, and it also can be done in conjunction with other tools that we have here in the office. But everybody is a candidate for it.
Yes.
And you could speak from the injectable side and what it does to help support, Botox and fillers and how it makes threads. And how it supports it better.
So therapy stimulates collagen with the heat, and so I love combining with treatments that stimulate collagen, whether it be mechanical with threads or with like things like sculpture or radius that are known to stimulate collagen too. Because I think when you add therapy to those treatments, it's like 1 + 1 = 3. We know we get better results when we put those two together around the same time period versus just waiting a year in between doing those things. Some people get those treatments done together the same day. I've had patients who thread and therapy the same day. That's a lot to get done in one day, but you can, I love it actually. So, therapy is slow though. It's slow and steady, but it wins the race. You don't see it immediately. There's no downtime from that treatment though, which is awesome. And now we have a mini menu where you could just do, let's say, do your brows one day, or you come and you do your eyes one day, or just like this area, so you're not sitting here for like an hour and a half. I don't even know.
It's definitely a customizable treatment for whatever the concern is, which is nice.
We like to laser treatments on top of it the same day quite a lot because why not? So you guys
we can. We have the tools. That's what differentiates us from other places. We kind of think outside the box, and we want to give all of you the best bang for your buck.
Yeah.
And I often describe it as, if you hire someone to come and build your house, you don't care what tools they use. You want them to build it safely, and get what you're paying for.
Yeah.
And we, practice the same way here, where, we do have the most advanced tools. It's our job to use whatever it is that we need to get you to the outcome that you want.
Yeah, like our ultra facelift that we do, which is all therapy, plus our radio frequency microneedling, plus our intraoral photona, which goes inside the mouth to like tighten up the jowls and everything like that.
It's pretty awesome.
That's pretty cool, yes. Yeah. So, so another question we get a lot is about the Osha P Shot. Ta-da! So, what is the Osha and P Shot? So, basically, classically, it's the injection of platelet-rich plasma, PRP, along the penis or into the clitoris, the G-spot. So why do we like that? Well, PRP is known to have 8 identified growth factors. Things that help with your blood vessels, your nerves, your collagen, helps to stimulate some regeneration. We think of some nerves and tissue. So how does that procedure work? Basically, you come in, we put some topical numbing cream along the penis or clitoris G-spot, and then we draw your blood, we spin it down and get the PRP, we inject it back into you. So PRP is about maybe 15, 20 years old. It's been around for a long time. We like it, but I like things like stem cells, exosomes even better because we know that it has more active good stuff in it. So I hardly do PRP anymore. It's more along this, now it's a lot more stem cells because we know that the cells live maybe up to 90 days, a lot more, hundreds more growth factors, so a little bit more viable. So we call that the X shot, the sex shot, man shot. We have a lot of different shots that we call, but those are popular. And so if you're confused about the difference between the shots, the lasers, the shockwave therapy that we do, basically we say these types of shots require homework. The homework meaning, for the men at least, they have to go home and we give you a penis pump to use because you want your penis to go up and down to get the blood flow and the circulation back.
People laugh all the time when we say penis pump.
Yes.
Back in the day, I think it was such a sexual thing.
Like the Osha power.
Actually, it's a tool that is going to help you achieve. It's no different than if you were to come in and get a laser treatment done and use your skincare.
Yeah.
It's your homework.
Yeah, the penis pump we have, it's very classy. I mean, you plug it into the wall, it's mechanical, it's very medical, it's kind of loud, but that's what penis pumps are. We also carry the bath mate, and that is the water one that you do in the shower that has an electricity, but it's not as controllable. So, but we like using the electric penis pump after the P shot. It's part of the classic protocol. Females, there is no extra homework that you need to do, right? So those are the shots. So not that scary. In terms of downtime, we just say refrain from sexual activity for females for a couple of days. Men, I say you're allowed to do whatever you want, but you're going to be a little numb for probably that first day because you've been through some topical numbing and injection numbing. So taking it easy afterwards. But yes, very popular because not much downtime. And yes, it does help your member get stronger and longer, because the penis pump does stretch the suspensory ligaments of the penis. You do get some length, but then you get the girth too. Actually, the girth comes first. We notice more sensitivity and girth off the couple weeks in. So that is how you go from a shower to a grower. Am I saying it right? Yes.
Yes.
So anything else you want to bring up for those questions that we got last week?
I don't think so. A lot of people ask about what our specials are going to be. You know, we have, you know, Mother's Day is going to be coming up, so keep a lookout for our Mother's Day specials.
Yeah, right now we have the Quo Day, actually. So Quo Day is the cellulite injection for your booty to get rid of the dimples. And right now, if you bank your Quo, you get a free session of M-Sculpt. And that's the traditional muscle building for the booty. So, you know, tighten and lift your butt and smooth it out, basically.
And I think we still have our cool sculpting special going on too, which is pretty awesome. So for every cycle of cool sculpting that you purchase, you get a complimentary M-Sculpt, which is amazing.
Yes.
If you're gonna, you know, reduce it, then you want to build the muscle. So that's a pretty, that's pretty awesome.
Come out of hibernation, basically. Yeah. Okay, well, thanks for tuning in, everybody. We will see you soon. Let's give our penises, you know, shape.
Have a great evening.
Bye.
Bye.